Let's get started. Start with listening, and then learn new words and practice them in sentences.
Ever wondered how to communicate your health issues in English? Imagine you're in a new city and suddenly need medical attention. You find yourself in a hospital, a place where understanding and being understood is crucial. To help navigate these situations, we'll take a look at some basic hospital vocabulary. First up, we have the word doctor. A doctor is a medical professional who diagnoses and treats illnesses. If you need to see one, you might say, I need to see a doctor. Next, we have nurse. Nurses are the healthcare heroes who assist doctors and care for patients. If you need help from a nurse, you might ask, can a nurse help me, please? Third on our list is medicine. Medicine refers to substances or treatments used to cure or prevent diseases. You might hear a doctor say, you'll need to take this medicine twice a day. Our fourth word is pain. Pain is an uncomfortable sensation in the body. If you're feeling unwell, you may say, I'm in pain, or I'm feeling pain here. Lastly, we have appointment. An appointment is a scheduled meeting with a healthcare professional. You might need to make an appointment with a doctor for a checkup or to discuss your health concerns. To do this, you might say, I'd like to make an appointment, please. Let's put these words into a simple dialogue. Imagine you're at the hospital reception. You might say, hello, I need to see a doctor, I'm in pain. The receptionist might reply, I'm sorry to hear that. Let's schedule an appointment for you. In the meantime, a nurse will come to help you. Understanding these basic terms and how to use them can make a world of difference when navigating the healthcare system in an English-speaking environment. Remember the words doctor, nurse, medicine, pain, and appointment, and practice incorporating them into your conversations. Now, you can identify key personnel in a hospital and ask for help in English. Getting the right help starts with describing your symptoms accurately. Imagine you're not feeling well. You've made the decision to visit a doctor, but how do you tell the doctor what's wrong? In English, there are a few simple phrases that you can use to describe how you're feeling. Let's delve into them. Perhaps you're experiencing a throbbing sensation in your head. You can say, I have a headache. This phrase specifically points out the problem area, which is your head, and indicates to the doctor that you're experiencing pain there. Maybe it's not your head that's bothering you. Perhaps it's your stomach. You've been feeling a sharp, uncomfortable sensation there. To communicate this, you could say, my stomach hurts. This tells the doctor right away that your stomach is the problem area. You might be feeling a general sense of discomfort, but you're not sure where it's coming from. In this case, you could simply say, I don't feel well. This is a broad statement that can prompt the doctor to ask more questions to better understand what's going on. Now let's put these phrases to use in a dialogue. Imagine you're the patient. The doctor asks, what seems to be the problem? You respond, I have a headache. The doctor may then ask, how severe is your headache? You could answer, it's very painful. This conversation helps the doctor determine the best course of treatment for you. Remember, these phrases are just starting points. It's important to provide as much detail as you can when talking to a doctor. The more information you provide, the better they can help you. In summary, when you're feeling unwell and need to visit a doctor, you can use phrases like, I have a headache, my stomach hurts, or I don't feel well to describe your symptoms. Practice these phrases and you'll be better prepared for your next doctor's visit. You've now learned how to share your symptoms with a doctor in English. Doctors always have questions. Are you ready to answer them in English? Let's imagine you're in a doctor's office and the doctor is ready to understand what's bothering you. One of the first things you might hear is, what brings you in today? This is your opportunity to describe your symptoms, like I have a fever or I've been coughing a lot. Remember, the doctor is there to help you, so don't be shy. If you're not sure how to express what you're feeling, try your best to explain. For example, you could say, I don't feel well, but I'm not sure why. Now the doctor might want to know more about your symptoms. They could ask, how long have you been feeling this way? You could answer with, since yesterday or for about a week now. Another common question is, where does it hurt? If you're having stomach pain, you could say, my stomach hurts. The doctor might also ask, on a scale from 1 to 10, how would you rate your pain? Remember, 1 means no pain, and 10 means the worst pain you've ever felt. So if it's a mild pain, you could say, it's a 2 or 3. Sometimes the doctor might ask about your medical history. Questions like, do you have any allergies? Or, is there a history of heart disease in your family? Are common. Be prepared to answer these questions to the best of your knowledge. And finally, the doctor might give you some instructions or prescribe medicine. They might say, Take this medicine twice a day, or rest and drink plenty of fluids. It's important to understand these instructions, so if you're not sure, don't hesitate to ask, "Could you explain that again, please?" Practicing these dialogues and understanding these common questions can make your visit to the doctor less stressful. Remember, it's okay to ask for clarification if you don't understand something. Now you can respond to a doctor's questions about your health in English. Let's recap what we've learned today. We've journeyed through the essential English vocabulary and phrases you'd need when visiting a doctor or hospital. We started with the basics, understanding that knowing the right words can make all the difference. Words like doctor, nurse, medicine, pain, and appointment are not just mere words, but your keys to expressing your needs when seeking medical attention. Then we dove into the art of describing symptoms. Being able to articulate how you feel is crucial. Phrases like, "I have a headache" or "my stomach hurts" are simple yet powerful tools in communicating your health status. Remember, the more accurately you can describe your symptoms, the better the healthcare professionals can assist you. We also practiced how to answer basic questions from a doctor. For instance, when asked, "Where does it hurt?" your response could be as simple as pointing to the area and saying, "It hurts here." Such direct responses can make a significant difference in your healthcare journey. But why is all of this important? Well, being able to communicate effectively about your health in English, or any language for that matter, is a skill that can profoundly impact your well-being. It's about being understood and getting the help that you need. It's about ensuring that you can navigate through healthcare spaces confidently and independently. So, keep practicing these words and phrases. Use them in your day-to-day life. Try to put them into sentences, create dialogues, and even role-play different hospital scenarios. The more you use them, the more comfortable you'll become. Just like learning any new language, it's all about practice and repetition. So, don't get discouraged if you don't get it right away. Keep at it, and soon you'll find yourself confidently navigating through your next doctor's appointment or hospital visit. With these words and phrases, you're now ready to visit a doctor or hospital and express your health concerns in English. Remember, practice makes perfect.
Let's learn new words and practice English at level A1. Doctor. Doctor, a person who is trained to treat sick people. Example, I need to see a doctor because I have a cold. Appointment. Appointment, a scheduled meeting with someone, usually a professional. Example, I have an appointment with the doctor at 10 a.m. Medicine. Medicine, a substance used to treat illness or injury. Example, the doctor gave me medicine for my headache. Pain. Pain, an unpleasant feeling in your body when you are hurt or sick. Example, I have pain in my stomach, so I need to visit the hospital. Fever. Fever, a high body temperature, usually because of illness. Example, I have a fever and feel very hot, so I'm going to see the doctor.